Hello, everyone. I'm Sarah. I'm a registered nurse with Live Healthy Chicago and Rush University Medical Center. And today we're going to be talking about managing cancer. The goal of today's discussion will be to learn more about cancer and how to take care of yourself at home. We'll be defining cancer, learning basic facts, getting information about cancer screenings, and learning more about prevention and self management tips. So, what exactly is cancer? Cancer is a disease in which some of the body's cells grow uncontrollably and spread to other parts of the body. Your body is made up of trillions of cells, and sometimes these cells can grow abnormally. Usually, your body can help prevent abnormal growth, but other times, these growths form lumps of tissues called tumors. Tumors can be cancerous, which might be referred to as malignant, or they can be non cancerous, which you might hear referred to as benign. Cancers are further defined and classified by what organ or tissue it started from. It's important to talk to your provider about what types of tumors are in your body if you've been diagnosed. Staging is a way to describe a cancer. The cancer stage tells you where a cancer is located in its size, how far it has grown into nearby tissues, and if it is spread to nearby lymph nodes or other parts of the body. Before starting any cancer treatment, a provider may use physical exams, imaging scans, and other tests to determine a cancer's stage. If you have been diagnosed with cancer, talk to your provider about your stage, what that means for you, and what treatment options may be available. In stage one of cancer, the cancer is localized to a small area and has not spread to lymph nodes or other tissues. In stage two, the cancer has grown, but it hasn't spread. In stage three, the cancer has grown larger and has possibly spread to lymph nodes or other tissues. And in stage four, cancer has spread to other organs of the body. Nearly 1 in 3 Americans is affected by some form of cancer at some point in their lives. Some cancers are more likely to spread than others, but the most common cancers are breast cancer, lung cancer, prostate cancer, and colorectal cancer. Even though these are the most common cancers, cancer can start from any point in your body. Many cancers can be prevented with lifestyle choices or treated early like a chronic disease. We'll be talking about management tips throughout the presentation today. It is important to talk to your provider about cancer screenings during your annual checkup, especially if you are over the age of 45. A screening test is used to find cancer early in people with little to no symptoms and gives you the best chance of treating it before it is spread. This chart shows the age ranges of when people should typically be screened for certain cancers. Though people of average risk should usually be screened around 45 years old for the most common cancer. Family history trumps this recommendation, however. So if someone in your family has a certain kind of cancer, you should talk to your provider about whether you should start screening at an earlier age. One of the biggest risk factors for certain kinds of cancer, especially lung cancer, is smoking and using tobacco products because it increases the toxic chemicals in your body and it promotes plaque in the blood vessels. Aside from cancer, smoking is a big risk factor for many other problems, like heart disease. If you smoke or use tobacco products, quitting is the best thing you can do to reduce your risk of cancer or prevent complications like a heart attack or stroke. Heavy alcohol use is also a large risk factor for certain kinds of cancer, such as liver cancer. Quitting or limiting the amount of alcohol that you use is important to reduce this risk. In general, men should limit their alcohol intake to 2 drinks or less per day. and women should limit their alcohol intake to one drink or less per day. Quitting smoking is hard, but your body gets healthier each day that it doesn't have tobacco and can significantly reduce your risk for cancer. Talk to your family and friends about your goals to quit or limit your alcohol intake. And talk to your provider about resources that may be able to help you quit drinking or smoking. This may include medication or nicotine patches. Being overweight can increase your risk for certain types of cancer. If you're overweight, trying to get to a healthy weight is a great goal to prevent cancer. Talk to your provider before starting a diet or exercise program and have them help you figure out what a good goal weight is for you. Even losing just a little bit of weight, like 10 to 20 pounds, can help you get started and prevent cancer or other complications from an unhealthy weight. Weight loss can help you in other ways too, such as experiencing less pain from arthritis, getting better sleep, and having more energy. Protecting your skin is an important way to prevent skin cancer, regardless of your skin color. It's important to protect your skin every day because the sun has harmful rays even on cloudy days. But it's especially important on sunny days or if you're going to be near a body of water. Tips to protect your skin are spending time in the shade, using sunscreen of at least SPF 30 every day, and wearing hats, sunglasses, and sun protective clothing when outside. Some vaccines can help prevent cancer from starting in the first place. HPV can be a cause of cervical cancer, and hepatitis B can be a cause of liver cancer. Vaccines are available to prevent both of these conditions. If you have cancer, an annual flu shot can help prevent the flu and keep you healthy otherwise. Talk to your provider about what vaccines might be right for you to prevent cancer or keep you healthy if you've already been diagnosed. If you've already been diagnosed with cancer, there are many treatment options available. It's important to talk to your provider as well as your loved ones to figure out your goals for cancer treatment. Some cancers can be cured, while others cannot. Even if a type of cancer cannot completely be cured, many can be controlled for several months or years. And this is called remission. Many people live normal, happy lives with cancer in remission. Certain kinds of cancer treatment options include chemotherapy, drug therapy, radiation, clinical trials, surgery, hormone therapy, and bone marrow transplants. If you've been diagnosed with cancer, it's important to be aware of palliative care and hospice care. While the objective of both hospice and palliative care is pain and symptom relief, the prognosis and goals of care tend to be different. Palliative care is for people of any age and at any stage of cancer. It's usually given while treatment is ongoing, and it can be given at time of diagnosis. This type of specialized medical care helps control pain, manage symptoms, and reduce stress while someone receives the treatment they need for their illness. It does its best work when added to the patient's care plan as early in the disease process as possible. It is not intended to treat the cancer itself, but the other physical or emotional symptoms that may be associated with a cancer diagnosis. Hospice care is for those living with cancer who have a life expectancy of 6 months or less. It focuses on comfort care and pain relief and is designed to maximize the quality of life. At its core, hospice is an interdisciplinary team who develop an individualized plan of care based on what is most important to the patient and their loved ones. It can be given at home, hospitals, or nursing homes. Managing cancer can be challenging for both you and your family, and it's helpful to have others around who can understand what you're going through. There are many support services for people with cancer. The groups listed on this slide are just a few. Support groups may be for people with cancers of all types, for people with your specific type of cancer, and for your family members as well. Individual counseling may also be an option. Talk to your provider about support resources that may be available for you. Caring for someone with cancer also presents its own challenges. Make sure to take care of yourself. It is so important. Remember, you cannot pour from an empty cup. Chicago Caregiver Respite Services provide professionally trained staff to care for a frail senior who has a familial caregiver on a temporary basis. The Rush Caregiver Initiative offers family caregivers of adults 65 and older the education and support needed to take care of themselves while caring for others. It provides a thorough assessment followed by services tailored to the needs of family caregivers. This presentation went over tips to prevent and manage cancer, but keep in mind that everyone is different. Talk to your provider about the appropriate recommendations for you and your specific situation, as well as screening and prevention tools. If you have been diagnosed with cancer, ask about treatment options and ways to control pain or other symptoms you may be experiencing. As always, take all medication prescribed by your provider. Thank you all so much for watching. Again, I'm Sarah, registered nurse with Live Healthy Chicago and Rush University Medical Center. Have a wonderful day.